So you think clear aligners are just for fixing a couple of crooked teeth? Well, think again. Today, we're going to dive deep into how this amazing technology is tackling some really complex smile problems. Yeah, I'm talking about the kind of stuff you probably thought needed old-school braces.
Seriously, have you ever done that? Stood in front of the mirror and just thought, nope, my teeth are way too complicated for something like clear aligners? You're not alone. That's a super common thought. But what if I told you the game has completely changed? The tech is way more advanced than you think.
And you don't have to take my word for it. Look at this. The technology today is specifically designed to tackle those really tough issues. We're talking big gaps, stubborn, twisted teeth, and major crowding. And it does it with a level of precision that's just, wow. Okay, so how on earth is this even possible, right? Well, it's not magic, I promise. It's this incredible partnership between super advanced digital tech and, this is key, the expertise of a real experienced doctor. So let's pull back the curtain and see how this whole modern solution really works. And it all kicks off right here. Forget about those awful, goopy trays of stuff that used to shove in your mouth. You know, the ones that made you gag and were never totally accurate anyway? Ugh. Now it all starts with a quick, totally comfortable 3D scan. It creates this perfect digital model of your teeth. It's clean, it's fast, and it's incredibly precise.
Okay, so now that we have that perfect digital map, we can get to work. Let's tackle one of the biggest things people want to fix: gaps. You know, those spaces between your teeth. Whether it's one big one right in the front or a few smaller ones, the goal is to close them up. And how they do it is actually pretty brilliant.
So there's a fancy clinical term for these gaps: diastema. But here's the thing you really need to know. It's not just about looks. Those gaps can be little food traps, and over time, that can lead to bigger problems for your gums and your overall oral health.
So how do the aligners actually do it? It's all about applying this really gentle but super steady pressure. Each tray in your series is designed to move specific teeth just a little bit at a time. And the amazing part is that every single one of those tiny movements is all mapped out digitally. It's totally controlled. They even have these things called attachments for trickier moves, which give the aligners extra grip to make sure everything goes exactly as planned.
But wait, how do you make sure you're only moving the teeth you want to move? Great question. That's where a technique called anchorage comes in. It's exactly what it sounds like. Think about a boat dropping an anchor so it doesn't drift away. Doctors do the same thing in your mouth. They use certain teeth as an anchor, holding them steady, so they can pull the other teeth into place without everything shifting around. It's super smart.
Okay, moving on. Let's talk about the big guns, the really tough challenges. I'm talking about teeth that are twisted or totally overlapped. For a long time, rotating a tooth, especially a rounded one like a canine, was a huge problem for clear aligners. But notice I said was.
Because now they have a secret weapon. And here it is: attachments. These little things are a total game changer. They're basically tiny tooth-colored bumps, almost like little handles, that are temporarily bonded to your teeth. Why? Because they give the smooth aligner something to grip. It's how the aligner gets the leverage it needs to literally twist a tooth into the right position. So simple, but so incredibly effective.
And this is not just some random process. It's all carefully planned out step by step. The doctor does the assessment, but then the digital tools help plan the perfect placement for those attachments to get the best leverage. The whole rotation is broken down into these tiny micro movements across all your aligners. It's all about making it safe, predictable, and super effective.
Okay, but what about crowding? When teeth are all jammed together, you can't move them until you make some room, right? Well, there's a technique for that too. It's called IPR, or interproximal reduction. Now, I know that sounds kind of scary, but it's really not. It's a completely painless procedure where they just polish a tiny amount of enamel from the sides of your teeth. We're talking fractions of a millimeter here. It just creates a little bit of breathing room so the teeth have space to line up properly.
And does it work? Oh yeah. Get this. There was a published case where an adult with pretty moderate crowding got their smile completely transformed with ClearPath in just 7 months. 7. By using these exact techniques. That's honestly incredible.
You just don't get results like that by chance. So what's the engine running this whole operation? What makes all these precise movements possible? It's the digital workflow. Let's take a quick look at how this process ensures everything is predictable from start to finish.
This is really the glue that holds it all together. It starts with that comfy 3D scan. Then, and this is the really cool part for you, the patient, the doctor designs your entire treatment on the computer. You can actually see a 3D simulation of how your teeth will move and what your final smile will look like before you even start. How cool is that? After you approve it, the whole thing is staged out, and your custom aligners are made just for you.
You know, we've been talking a lot about how teeth look, but this is about so much more than just a pretty smile for pictures. Fixing your bite has huge benefits for your actual health. And honestly, this is the part that really matters most.
And this quote really nails it. The aligners aren't just pushing your teeth around, they're also acting like this soft, protective cushion between them. So while they're guiding your teeth, they're also potentially protecting them from things like grinding and helping your jaw find a happier, more comfortable position. So, let's break down what that actually means for you. We're talking about potentially relieving jaw pain and TMJ issues. We're talking about your teeth biting down evenly, which reduces weird wear and tear. It can even discourage clenching and grinding. Plus, and this is a big one, straight teeth are just plain easier to brush and floss, which means healthier gums. It is a total win-win for your long-term health.
And one of the best parts is how this all fits into real life, right? It doesn't matter if you're a teenager or a busy adult. For teens, they're basically invisible, and you can take them out for sports or playing an instrument. For adults, you can go to work meetings without feeling self-conscious, and the convenience factor is off the charts. It just works with your life.
So when you put it all together, you've got this amazing technology, the critical guidance from a doctor, and all those life-changing health benefits. It really leads to one simple conclusion. That perfect smile you might have written off as impossible, it's probably a lot closer than you ever thought.
So really, the only question left to ask is, what's possible for your smile? The tech is ready and waiting. All it takes to find out is a conversation with a ClearPath provider. They can show you exactly what a plan could look like for you. Thanks so much for tuning in. I hope this has really opened your eyes to what's possible these days.